It was a rare bit of good news to start the day today. A bipartisan, although imperfect, agreement reached while we were sleeping on a $2 trillion stimulus package meant to help struggling businesses and average Janes and Joes.
Good news for the doctors and nurses in emergency rooms around the country. It's good news for families all across America.
To all Americans, I say, help is on the way. Big help and quick help.
But not that quick. The bill was still being written up as of this afternoon, and there's still a number of senators and House members on both sides who say they have concerns. So while the details are still being hammered out, here's what we do know. The bill would include $100 billion in aid for hospitals and health systems, although some, like New York Governor Andrew Cuomo, says that's not nearly enough. Individuals who make up to $99,000 would get some direct payments, with those who make $75,000 a year or less getting the maximum $1,200 payment. Families would also get $500 per kid. Unemployment benefits would be extended 4 months plus 13 more weeks of insurance, and both of those would include gig workers like freelancers and Uber drivers. Small businesses would get emergency federal loans, which would be forgiven if they keep workers on the payroll. Any government bailouts come with conditions. Any company that benefits would not be able to buy back stock for a full year after getting assistance. And the biggest of all, no Trump family business or that of any other senior government official can get money from that particular fund. Now that's something to celebrate. But that's about the extent of the good news. Here in Massachusetts, the coronavirus death toll rose to 15 today, and Governor Charlie Baker announced he's extending the statewide school and daycare shutdown until May 4th at the earliest. The WHO is now warning the U.S. could be the next epicenter of the pandemic, and a leading epidemiologist at the CDC is estimating the peak of deaths will be around 3 weeks from now. And yet, the president still hasn't backed down from these statements he made yesterday.
I would love to have the country opened up and just raring to go by Easter. You'll have packed churches all over our country. I think it would be a beautiful time. Our country is not supposed to be, it's not built to shut down. Our people are full of vim and vigor and energy. They don't want to be locked into a house or an apartment or some space. It's not for our country.
Is there something special about us that's not true of the rest of the world? I'm joined by Dr. Thomas Tsai, who's a surgeon at Brigham and Women's Hospital, an assistant professor at Harvard's T.H. Chan School of Public Health, also a former advisor in the U.S. Department of Health and Human Services. Dr. Tsai, it's good to see you again. So, in one corner, the WHO says we could be the epicenter. The CDC is saying maybe 3 weeks from now we reach a peak. In the other corner is the president, who says coincidentally, almost exactly at the same time, 3 weeks from now, we should be filling the pews for Easter. Is he giving the people of America false hope, Doctor?
I think he is. In this time of crisis and uncertainty, what we have to rely on are data. We have to let the data and the evidence that we have available to us guide us. That means the data on how many tests are being done, how many cases are being identified, and how many patients are being hospitalized, and unfortunately, how many patients are dying all across the country, but also in our state. So especially in this times of doubt and uncertainty, we have to rely on hard, objective facts. And what the facts are telling us is that the epidemic is real, and it is rapidly growing.
You know, Dr. Fauci yesterday, who has perfected the respectful dance without directly contradicting the president, said very much the same as you did. We're going to look at the data when Easter comes, when 3 weeks come. What specifically would a Fauci need to see to say it's okay to start, to use the president's words, to open up the economy in some parts of the country?
I think we have to see that we truly have flattened the curve in terms of the number of cases are being identified through community transmission. We are far from seeing that. If anything, our growth curves are outpacing a lot of the other countries around the world, which is why there's a true fear that we may emerge as a potential new epicenter for the global pandemic. So we have to see the transmission of the cases go down. We have to see the hospitalized cases go down. We have to see our mortality rate go down. And unfortunately, all the data are pointing in the opposite direction.
Well, there's one piece of good news. While the bad news for New York City is obviously it's the hot spot, to quote the president again, the good news, according to Governor Cuomo today, is the spread is slowing. At least the increase is slowing. Is that good news? And is there some lesson we can take away from what's happening in New York?
Governor Cuomo and the state of New York has responded in a very rapid fashion to head off the epidemic through lots of different means. And I think the silver lining to the data coming out from New York, which is frankly very tragic. I'm hearing stories from colleagues in hospitals in New York City, and it's just a very overwhelming scene. But what the city has done in terms of really engaging the citizens to shelter in place, to break the transmission and prevent the transmission from spreading out of New York to other parts of the country and other parts of the state, shows tremendous resolve on the part of the government, but also shows what's needed on a large scale in order to break the transmission in the community.
Have we shown similar resolve here in Massachusetts? No, as of noon yesterday, the governor ordered non-essential businesses to shut down, but he was very careful to say his stay-at-home policy was an advisory. It was not a mandate. Is that enough?
I think we're getting better. I mean, the announcements of the further closure in the schools, the announcements over the last several days about staying home, closing non-essential businesses, is steps in the right direction. My fear is, and the fear of a lot of public health experts and researchers, is that we may be days behind what's happening in New York, and more drastic measures may be needed.
You know, speaking of fears, you co-authored a report recently talking about potential critical shortage of ICU beds in different parts of the country, but I want to focus on Massachusetts. But after you wrote that report, I spoke to you on the radio with Marjorie Egan a couple of days ago, and you said, based on recent developments, you think we have a fighting chance, were your words, I think, to catch up. Do you still feel that way 48 hours later, or are we losing that fight?
I still think we have a fighting chance, and we always will. What New York has showed is that with strong resolve on the government level, on the public health agency level, and the hard work of the clinicians, nurses, and doctors on the ground, you can slowly try to beat back this pandemic. So I'm still worried, but I believe in the clinicians that are fighting hard in Boston, in our hospitals every day, and to treat these patients. And I believe that the citizens of our state will realize how serious this is, and we will be able to break this transmission.
You know, from afar, I have to say, I couldn't agree with you more about the clinicians. Every person I've spoken to who does what you do, nurses, doctors, everybody who helps out, I've heard only wonderful things about and from. However, the ICU beds, it's not about resolve. There are only so many ICU beds. We're told there are 1,400 ventilators in the whole state, which every health expert who I've read or heard or spoken to has said is not nearly enough. So your optimism on the clinician front, is it matched on the supply front? Will we have enough beds? Will we have enough masks? Will there be enough ventilators?
We know there are not enough masks now. We are rationing supplies to our clinicians as we speak. But what's needed right now is to take that and start planning contingency plans like they have in New York in terms of increasing extra capacity. Last week, 2 weeks ago, we were fighting hard to increase current capacity by postponing elective surgery and freeing up the available beds now. But what we need to plan is for the next few weeks is not just preserving the capacity we have now, but start thinking about how we build and add on to extra capacity. That's just not beds and ventilators. That also means people. How do we preserve our workforce, protect our workforce now so they can be there a week, 2 weeks from now to take care of the patients when they're needed the most?
Before you go, how is that workforce doing in terms of the mental stress of being on the front lines here?
Doctors and nurses I've talked to, we're all scared, but everybody's committed to taking care of patients. But we need help. We need support. We need the equipment, the respirators, the masks. We need training to take care of these patients. The policies and protocols are changing constantly as we react to new information, but they can't just be pieces of paper. We have to drill. We have to train. And that needs to happen every single day. So the clinicians and nurses, we're worried, but I believe that there's a lot of resolve, and we'll do what we always do, which is take care of patients.
Dr. Thomas Tsai, thanks for your time and, of course, for your work. Really appreciate it.
Okay, thank you, Jim.
Thank you so much.